In day-to-day pediatric practice, palpable neck swellings are very common and most turn out to be lymph nodes. In this clinical video, we will see a case of neck swelling and learn to evaluate it. With these words, I am Dr. Manish and I welcome you all. So let's start. Seven-year-old male child weighing 16.3 kilos presented with complaint of boil for 10 to 11 days and swelling behind chin for 6 days. On examination, single spherical, smooth skin-colored swelling measuring approximately 1.5 cm by 1.5 cm is present behind chin. On palpation, temperature of the overlying skin is not raised. Swelling is tender, uniform in consistency, non-fluctuant and mobile. On further examination, a boil is present near angle of mouth on right side. Based on presenting complaints and examination findings, differential diagnosis for midline neck masses includes lymphadenopathy, Thyroglossal duct remnants, and dermoid cyst. As swelling appears after boil is tender and mobile, so a diagnosis of enlarged infected submental lymph node is made. When approaching a child with lymphadenopathy, there are few clinical relevant points which should be remembered. Let's discuss these in a question-answer format. So the first question is the mass a lymph node? This has to be confirmed first with history and physical examination, as non-lymphoid masses frequently confused with lymph nodes. After confirming that the mass is a lymph node, the next question to be asked is the node enlarged? And the answer is nodes are considered enlarged when their diameter exceeds 1 cm for cervical and axillary nodes and 1.5 cm for inguinal nodes. An important point to remember here is that lymph nodes are usually not palpable in the newborn. The next question to be asked is, what are the characteristics of the node? And the answer is, acutely infected nodes are usually tender, as in our case. There may also be erythema and warmth of the overlying skin. Fluctuance suggests abscess formation. Tuberculous nodes may be matted. With chronic infection, many of these signs are not present. Tumor-bearing nodes are usually firm and tender and may be matted or fixed to the skin or underlying structures. Finally, the question to be asked is the lymphadenopathy localized or generalized? Generalized adenopathy is caused by systemic diseases and is often accompanied by abnormal physical findings in other systems. In contrast, regional adenopathy is most frequently the result of infection in the involved node or its drainage area. It should be remembered that in infectious agents other than bacteria, adenopathy may be characterized by atypical anatomic areas, a prolonged course, a draining sinus, lack of prior pyogenic infection, and unusual clues in the history. A firm, fixed node should always raise the question of malignancy, regardless of the presence or absence of systemic symptoms or other abnormal physical findings. Finally, coming to treatment, as lymph node gets enlarged secondary to boil, so antibiotic covering at least Staphylococcus is started. That's all for now in this video. If you have any queries or suggestions, then do post in the comment section below. If you haven't liked or shared yet, then do like and share this video and don't forget to subscribe. Thank you.